Hello students, welcome to this session. Today we are going to study about disinfection. That means how to clean the surfaces. Third type is the low level disinfectant. It destroys all the vegetative and enveloped viruses. Other actions is invariable. So example, quaternary ammonium compounds. So mechanism is by producing enzymes, denaturation of the cell proteins and cell membrane. The preparations are the benzyl ammonium chloride, but it is not acting in presence of hard water. But newer generation quaternary ammonium compounds are active in hard water and better compatible. Cleaning agent. So cleaning is important step for the before disinfectants applied to remove organic matter, because few reagents do not act in the presence of organic matter. So the examples are enzymatic cleaners. So they contain enzymes like amylase, lipase and protease and all. Cleaning chemicals. So they are detergents. So manual cleaning and automatic mechanical cleaning like ultrasonic washers, disinfectors. Let's study sterilants. So these are the advanced techniques like ETO and plasma sterilization, and most commonly used in the CSSD, that is Central Sterile Supply Department. Test for chemical disinfectants to check the efficacy potency of the disinfectants. So the various methods are available. So first is a Riddle-Walker or phenol coefficient test. Second is the Chick-Martin test. Third is the capacity, that is Kelsey-Sykes test. And fourth is the in use, that is Kelsey-Maurer test. Ethylene oxide or ETO sterilizer most commonly used in the CSSD. Mechanism is microbicidal, where it causes disruption of all the cell components, that is cell proteins, DNA and RNA. The sterilization cycle you have to carry out in the 3 stages. So first preconditioning, then sterilization and then aeration. Preconditioning, air is replaced by the vacuum. Sterilization, ETO is allowed in the chamber. So gas concentration, temperature, humidity, exposure time should be noted. Then aeration, that is degassing. So extensive aeration to remove residual ETO, because ETO is a toxic and carcinogenic. The uses used by CSSD to sterilize critical items, sometimes semi-critical items that are moisture or heat sensitive and cannot be sterilized by steam sterilization. So examples: heart-lung machine, components, sutures, catheters, stents, respirators and dental equipment. Advantages: suitable for the heat sensitive items. It has high penetration power, highly diffusible, penetrates areas that cannot be reached by the steam, non-corrosive to plastic, metal and rubber material. Disadvantages: highly inflammable, irritant, explosive and carcinogenic. So ETO is usually supplied in 10 to 20% concentration mixed with inert gases like either CO2. The long duration of cycle 12 to 14 hours. High cost of instrument and consumable. Sterilization control: spores of Bacillus atrophius is the biological indicator. Second is the plasma sterilization. So it is a gaseous state consisting of ions, photons and electrons and free radicals such as O and OH. So it is the most commonly used device in the CSSD to create plasma state. So process: first vacuum is created, then second chemical sterilant, that is H2O2, is vaporized for 50 minutes at low temperature 37 to 44 degrees Celsius. Then gas plasma is produced by the applying electric field. Last step, excess gas is removed. No aeration required because byproducts are not toxic. Cycle duration 75 minutes. Uses by CSSD for sterilization of materials and devices that cannot be tolerating the high temperature and humidity of steam sterilizer. Example: plastics, electrical devices, corrosion susceptible metals such as orthoscope. Precautions or disadvantages. So my item should be dried before loading. Then linen or paper or cellulose liquid cannot be processed, may not penetrate well, especially in channels or devices for long lumen, has small chamber, cannot be used for bulky amounts, expensive equipment and packing materials. Sterilization control is the biological indicator, spores of Bacillus stereothermophilus. This chart shows the concentration of the disinfectants: glutaraldehyde 2%, phenol 5%, sodium hypochlorite 5%, chlorhexidine 1 to 4%, povidone iodine 10%, alcohol 70 to 80%. So these charts suggest the summary of the all disinfectants. So glutaraldehyde, Sidex aldehyde type 2%, mostly for the sterilization of all the scopes. Povidone iodine, halogen group 2 to 10%. It is used mostly as an antiseptic, wound clinic and mouthwash. Dettol, phenol X group, mostly antiseptic for the wound. Hypochlorite, so it is 1 to 5%, mostly 1% hand washing, 4% disinfectant. Hydrogen peroxide, oxidizing agent 3 to 5%, disinfection of the wound and environmental surfaces, mainly used for the fogging. Formalin aldehyde group 10%, preservation of anatomical and histopathology specimens. Phenol carbolic acid 5%, disinfection of environmental surfaces, floor, walls, disinfection of the sputum, skin, antiseptic. These are my references. Hope you find this session useful for your understanding and for your exams. Thank you.